Hi, good morning. This is Dr. Yoon Han Kim, and I'm a functional nomad MD. And today I want to talk about my personal health issue that I had and I'm still dealing with. And I want to share with you how I lost 50 pounds. And that was the easiest weight loss that I experienced, and I was able to keep it off. So now I am actually going what I call level two, and gaining more benefits from it. So what happened is during COVID period, and then I was away from home, and I was living in a hotel, and I think I really used food as a comfort food, and I gained weight. I gained weight until I realized that was a problem. So I did what they call internet keto, and internet keto. There's all kinds of variations, but and it was helpful, but it wasn't until I really discovered Dr. Eric Westman's Duke Keto program that made all the difference in the world. And what what it did for me is that. So let me talk about Duke Keto. Duke Keto is very interesting because what you do is you eat protein first, and you don't have to like measure out how much you're eating. So you can eat uh, meat, poultry, fish, shellfish, and eggs until you feel you're full, and then you get to eat 2 cups of leafy greens or 1 cup of non-starchy vegetable, and it says try not to eat nuts because they're so delicious, and we just keep on eating them. And then obviously high carb foods are not allowed. You can have 20 grams of total carbs per day. In the beginning, I think that using the keto bread is okay. Just using the carbs is okay. So you don't have to measure the ketone. I think it's a good idea. Um, and you don't have to use MCT oils or exogenous ketones or keto supplements. And you don't have to fast. So it's really easy. And most of people see 1 to 2 pounds per week without necessity of exercise. And a lot of people say they don't need medications for diabetes, hypertension, or GERD as their symptoms get better. So you people say that their heartburn gets better, joint pain gets better, fatigue gets better. So the thing to do, I would say, is YouTube. Dr. Westman has only 600 videos. You can watch some of them, or he's got a website called Adapt Your Life. You can Google that and look for that. And I'm very a proponent of Dr. Westman's program. So that's the level one. If you do level one, you will get result, and depending on your genetics, you'll be fine. Um, Unfortunately for me, I think good Lord made me to be a survivor, and it in my case there was a complicating picture, which is known as energy toxicity, and that means that my body has accumulated too much energy. And even with Duke Keto, because Duke Keto, remember, it doesn't watch for calories. So even with Duke Keto, um, for majority of people that I see in clinic, they're fine with Duke Keto. And I myself lost about 50 pounds, but I got stuck last 30. So what I am doing, we'll talk about another day. But Duke Keto is really amazing program. And if you do strict Duke Keto, no sugar added, when I converted to carnivore, I didn't see much benefit. As a matter of fact, Duke Keto, I believe, is superior to um, carnivore because it's much more flexible. And also, whenever I do keto, I don't have any GI side effects in terms of constipation and whatnot. But when I do carnivore, that's a different story. Constipation is something I've never had constipation until I did the carnivore. Now, it's not to say carnivore is not helpful. It's just saying that I'm just saying for me it wasn't helpful. If you find it helpful, then I think that go ahead and work with a healthcare professional, or watch Dr. Ken Berry, who advocates for carnivore, and carnivore really suits him. After he did carnivore diet, he looks better. One of the things that I don't like about carnivore is that the fact that vitamin C can be an issue, and there are reports of people getting scurvy because people are not getting enough vitamin C. So the only thing I would say is take um, daily vitamins, and maybe every time you eat maybe 500 milligrams of vitamin C, and that should both of that should take care of that. This is Dr. Yoon Han Kim. I'm functional nomad MD, and if you have a weight issue, I highly recommend to Google Duke Keto or Eric Westman, or visit Adapt Your Life, because that it was the easiest way that I lost, and easiest way to keep it off. Whenever I incorporated carbs, Dr. Eric Westman calls that carbohydrate creep, and I would gain weight. So I wish you the best, and I wish you much luck and much fortitude in your journey. And no matter how you lose the weight, there's no wrong way, in my opinion. Surgery is okay if that's what you want. The Ozempic or GLP-1 medication, that's fine too. You want to do like product based, that's fine too. Just do it. Just do it because you're worth it. Just do it because your health depends on it. And um, just do it. Just do it. And keto for me was the easiest. So that's what I'm talking about. And one day I'll talk about the level 2. If there's any requests, let me know any questions, and I'll make another video out of that. Thank you. I appreciate you.